How to manage your child's ear infection, created by SJVC students. What are earaches? Earaches can be caused by fluid behind the eardrum, such as the middle part of the ear, or an infection, known as swimmer's ears. Earaches in children are common, but can be more common in children under 5 years old who are at a higher risk for ear infections. Some other risk factors are upper respiratory infections, known as the common cold. What is a middle ear infection? An infection happens when germs like bacteria and viruses get inside the body and causes trouble. The middle ear is a small pocket of air behind the eardrum. A middle ear infection occurs when germs get into the middle of the ear and the area fills up with fluids or pus which contain germ-fighting cells. When the pus builds up, your ear starts to feel like a balloon that is ready to pop, which can cause discomfort or pain. So you're probably wondering how you get an ear infection. Between your middle ear and your throat, there is a passage called a eustachian tube. The eustachian tube keeps pressure from building up by letting air move in and out of your middle ear. When you were young, especially before you turned 3, the eustachian tubes were very small and less able to keep germs out. The eustachian tubes get longer and usually work better in older kids, but they can still get problems. If you have allergies or catch a cold, the eustachian tubes can get blocked up and let germs get in the middle ear. Then the number of germs can grow inside your middle ear and cause an infection. Ear problems in children. Ear infections is the most diagnosed bacterial infection in children younger than age 7. Most ear infections occur in babies between the ages of 6 months to 3 years old. After age 7, ear problems may be related to inflammation, infection, or fluid buildup in the middle ear. It can often occur in children who spend time in daycare settings, who are bottle fed, who uses a pacifier, who live in households where smoking is present, who has had previous ear infections, or those who have allergies. Some other common causes of ear pain in children are teething, having a sore throat, an accumulation of earwax, an object that's been dislodged in the ear, air pressure changes such as flying, or fluid buildup without an infection. Signs and symptoms of an ear infection can include ear pain. This can happen when your child is chewing, sucking, or lying down. Then there's redness or swelling that can be seen on the outer ear. Your child can also start to pull or rub the ear. Watch for cues when your baby's or child is constantly pulling or rubbing ear. Next is leakage from the ear. This can look like clear fluid, pus, or blood-tinged fluid. And then watch out for fussiness or a fever. This can be accompanied by vomiting or a headache. What to do when you suspect your child has an ear infection? First, call your doctor for advice or to have your child's ear checked. You can also give your child acetaminophen or ibuprofen such as children's Tylenol or Advil to relieve the pain. But remember to always check with your doctor before giving any medication. And as always, check instructions carefully for a correct amount depending on child's age and weight. Get medical care if your child seems ill while they're on antibiotics, or if your child has trouble taking liquids, or if you find ear drains pus-like fluid or blood, if the ear pain worsens, or if there is increased swelling or redness behind the ear. How to help your child with an ear infection. Here are some ways you can help relieve pain and discomfort experienced by your child. First, prop them up with pillows. Propping up with pillows help ease pressure and pain in the middle ear. Next, try using a warm compress. Apply a warm compress to the affected site to help alleviate pain. You can also try medication for pain relief, such as children's Tylenol or Advil. Always remember to check with your doctor first before giving any medications. How long can an ear infection last in children? Symptoms in children usually resolve within 24 hours. If fever and sharp pain does not resolve in 48 to 72 hours, then the National Institute of Health suggests starting your child on antibiotics by consulting a doctor. What happens at the doctor's visit? Your doctor will look into your child's ear using an otoscope or a small flashlight to view the eardrum. Your doctor may even suggest watching symptoms over the next few days to see if they have improved, or they would suggest pain relievers. They can also start your child on antibiotics, but make sure you take your medications as instructed. And for frequent or chronic ear infections, your doctor may suggest an audiogram, which is a hearing test, and a tympanogram, which is a machine that checks whether eardrums move normally. Here are some ways we can prevent ear infections. First is vaccinations. Make sure your kids get the PCV vaccination or the flu vaccine, which decreases their odds of getting middle ear infections. Next is cleaning the ears. Do not clean ears with cotton swabs or sharp objects. Instead, use a cloth or tissue to wipe away any earwax that has migrated out of the ear canal. Next, don't give a bottle lying down. Instead, hold your baby in an upright angle with the head higher than the stomach to prevent fluids from flowing back into the middle ear. Lastly, practice hand washing. Make sure your kids get in the habit of washing their hands, especially after being around other kids or those who are sick. For more information or questions about ear infections in children, contact your healthcare provider or feel free to access the reference page here listed.